today I am very, very fortunate to be sitting not directly across because we're online, but with three people that I respect a ton. And we have people from all around the world today. We have me from Canada. We have Diego from Spain. We have Leada from San Francisco, and Zach currently residing in Boston, right?
Close
No,
enough.
it's
We
New
were there
York,
for
right?
7 years. Yeah,
Yeah,
Rochester,
yeah.
New York. Yep.
Right.
Nice.
And the purpose of today's podcast is to help all of the students and new graduates that are out there that have concerns, confusion, and anxiety about either starting practice for the first time or just navigating the world as a clinician. So, first off, thank you again, all of you, for joining. I'm really excited to pick all of your brains. And let's start with some introductions. So let's start with Leada. So would you mind telling us a little bit about yourself, what you do, and also how long you have been a clinician for?
So my name is Leada. I am in the US, a board certified sports clinical specialist, and I have my NSCA CSCS, there's Certified Strength and Conditioning Specialist certifications. I went to Samuel Merritt for my Doctor of Physical Therapy. I've been practicing for, I think this is going to be year 8. Which is crazy to me. But I've been in the Bay Area my whole life. I primarily work with active individuals, but athletes, particularly the young athlete to the elite and collegiate athlete. I occasionally get masters athletes, definitely include dancers in my population. I like to speak on things that don't usually get the spotlight they deserve, like mental health as it relates to injury rehab, eating disorders, Red S, that kind of thing. But yeah, I'm excited to talk.
We are too. Zach, do you want to go next?
Sure. So yeah, like Leada, I've been practicing, I think nine coming on 10 years now, and it does fly by. So I graduated from Ithaca College in 2015. I had my CSCS. I actually let it lapse, but that's still a huge part of my identity in terms of promoting strength and conditioning and what I do. I was in a kind of traditional, really great sports medicine practice for about 7 years, but now in Rochester, New York. And I'm 2 days a week in a performance clinic that's cash based. And I'm running my own remote rehab business with a small caseload, which has been super fun because I feel like that platform really aligns with the delivery of care that I feel like certain populations, it serves them better almost. And then I founded Level Up in 2017. We merged with Clinical Athlete to become Calu. And the long journey is, as a brand, Calu was a challenge, but we're actually moving forward as Clinical Athlete. So my primary role is kind of leading the charge with that education company. And like Leada, kind of advocating for some of the non-sexy things in rehab can be really challenging, especially in a con ed world where it's really seductive and easy to fall into some of the flashy things. But really trying to, our big three is helping cultivate critical thinking, communication, and exercise prescription skills.
Awesome.
I'm the final one. So my name is Diego. I'm a physical therapist working in Madrid. I'm a kind of a newcomer because I've been practicing for less than a year. So that said, I work as a journalist and I studied journalism before starting my journey as a physical therapist. And at this moment, I work mainly with orthopedic sports, I would say, setting. So many ACLs. I work with many kinds of chronic pain, low back pain, neck pain, that kind of stuff.
Awesome. So this panel was selected because, number one, there's a mix of, I guess, length of time as a clinician. So I'm also on the younger end of things. I'm in my second year of practice. Leada and Zach, you guys have experience as a clinician and as educators and as entrepreneurs as well. And Diego, you're on just because your level of expertise and knowledge is unbelievable. And for anyone who doesn't follow Skeptical Physio, you have to do that now. Pause the podcast, go to Instagram and go follow him because the information is unbelievable. So I think it would be really interesting to pick all of your brains and just gather these different perspectives. So The first thing that I want to ask is, if you could go back in time and you could say one thing to yourself as a physical therapy student, what would that thing be?
Whew. I think I know.
Good question.
All right, Zach,
You
let's hear
start,
it.
Zach.
I wish that I think we're all so excited and passionate about what we do, which is amazing. But it can lead to us feeling really, really, really strongly and really, really confident about all the new things we learn. And I wish that I had been exposed to people like Diego and Skeptical Physio earlier to give me that earlier dose of humble pie and just learn to hold things a little bit more loosely. So it doesn't mean you still can't get super excited and super passionate, but there were so many times where I thought I had it all figured out, like as a graduating physio. And then like a year out when I went through my first existential crisis, and then 3 years later when I was deep in the pain science rabbit hole, and then 5 years later when I thought I had it all figured out again. And the idea is that the more you practice, the more you get exposed to, the more you kind of know that you don't know in a way. And it can be I think just really important, again, not to dismiss any of the things that you learn and feel passionate about, but again, just having a little bit more flexibility so you don't get so wrapped up in any one way of being, because that was a really big challenge for me, was like confronting my identity as a physical therapist who thought my worth was defined by my hands and my hard skills. So yeah, I'll wrap up there.
Beautifully said.
In my
I
case,
have to
okay,
agree. You go ahead, Diego.
thank you. And yes, I agree, of course. But in my case, I think that my journey has been different in some sense because I was exposed very early on to people like Zach or Leada or Greg Lehman. So during my first year, I was already like reading all these people. I was kind of uh, experiencing in some ways their struggles, and because I followed people that are at a different point of the journey, I was like, okay, so Adam is now destroying everything and Greg Lemon is saying that everything is kind of okay, Ben is saying that strength is not necessary for pain recovery. So I have tried to embrace all of those minds within me since I started my journey as a student. So in that sense, I think that it had some things in my favor, but and that's the thing that I will tell my younger me: don't get into fights with your teachers. That's like the number one thing that I should have done better, because I didn't know how to manage that at that point. And I think I'm kind of like Aaron Kubal, that those anecdotes that he had, like raising his hand and saying, "You're all wrong, and you don't know anything, and according to McGill, the year 2016, you're all wrong." So I was that kind of person, and I'm not that person anymore, even when I kind of keep thinking that stuff.
It's very fortunate to be able to go to school and not have an existential crisis like Zach.
Yes.
That's so interesting.
Lita, yeah.
Yeah, I think
Do you have anything to add there?
yeah, I agree with Zach, and I think it's really interesting what Diego brought up because I think it's really different to go to PT school now than it was 10 years ago or even longer. Like with social media, I forget how little we saw online when we were in school. And when I'm an adjunct faculty professor at this point, and I have students come to me asking about certain things on social media, and I'm in it, and I'm like, careful with what you read. And they're like, is this a valid resource? I'm like, look, I'm really happy that you're looking into this and it's cultivating that curiosity. But it all goes back, I think, to my piece of advice for myself or just anyone is just similar to Zach's. But I just say don't get too attached to anything because it's very fluid. Your thinking will change, the evidence will change, your mode of treatment will change, as it should, or I hope it does, because if you didn't, that would be really weird. And you'd be like that one really old physical therapist that still practices like it's 1975. And that's strange because it's 2024 and you should be evolving the way you think and the way you treat. And while there is some tried and true methods, from way back when, it's like having an open mind. You can definitely do that. Like if you're stuck on one thing, that's fine, but you have to maintain an open mind because that's what makes us a science. And if we don't, what does that make us any different than the profession that dismisses the science, whatever that may be? So I think just
Mm.
don't get too attached. I love Diego's username, Skeptical Physio, because it embodies a lot of what I feel like you should take forward. Like Zach said, don't be passionate. I often say stay curious, question things, but not in an effort to disprove them all the time. Just learn what is it that makes that paper speak the way they do about one thing, and where is this coming from, and understanding that everyone's got a different experience. And I hope you learn to evolve your thinking, but you got to start out as a generalist first. So just welcome that because you'll get there.
Mm. Yeah, when I think back to my schooling, there were multiple times where we were shown slides with someone's Instagram post on them. Like we would have an
What?
Adam Meekins
Crazy.
post, or we would have, yeah, it is wild.
So funny.
And then we were just like, we were taught to critically think about these things. And it
Yeah.
wasn't
That's
just,
awesome.
it is,
That's an
yeah, it
assignment
is.
at my program. Is they're like pick 5 accounts and dive in. And I'm like, okay. They're like, Leada, is this a good one to do? I'm like, no, I'm not saying anything. Just you do your thing.
Oh boy.
Yeah, you got to train your brain yourself.
Yeah.
Yeah, and it's so important to I think what you said, update our worldviews and not hold on to things too firmly. And I think us four are pretty biased towards exercise, for example. So like it's even in that context, I think it's sometimes important to think about, when you have other tools, and even for your biases, or especially for your biases, I think we should
Right.
be ready to let those go, because we tend to want to hold on to those, I think, the tightest, right?
Right.
Totally. I mean, with exercise, it's like I, went through a phase where I really felt strongly about exercise from a efficacy with pain, where now we can move forward and understand with a little more humility that it might not be as
hmm
amazing as we thought when it comes to pain rehab, but for different reasons, still a huge advocate of it because some of the side effects that come along with advocating for strength training and all the other psychosocial benefits that come
Right.
along with it. But yeah, definitely, again, those multiple iterations of feeling like you have it all figured out and then like, damn it, this isn't the time, I guess. Maybe next time I'll have it all figured out.
Yeah. Yeah, well, we won't be able to replace those secondary benefits of exercise. Like exercise will always be important until, you need to, I guess, like have a robot exercise for you in the future. But until then, exercise is always going to be important, but maybe not the most efficacious thing from a pain standpoint in all contexts.
Yeah, we have Greg to thank for humbling us there.
Yeah, exactly.
One thing I'll add real quick, just to your point, Noah and Diego, like, love your skeptical physio, like, amazing. We're huge advocates of that. I think one thing we got pushback on that just, again, made me kind of update my relationship with it is the notion of kind of practical skepticism, where like I think of like the bell curve, where it's like you could be that like skeptical person where it's just like you're literally challenging and asking questions about literally every single thing, which not inherently bad, but there's probably a sweet spot of, continuing to challenge and question, but not at the sake of like losing your sanity and being that person that has zero confidence in anything you're doing.
Yeah, and I think if I was to go back and talk to myself as a student, that would be one of the main things I'd want to say to myself. I think just really hopping on that skeptical bandwagon was something that I did and questioned everything. So we're talking a lot about being skeptical and sort of updating our worldview on things. And I think a lot of people tend to have a similar experience that you mentioned, Zach, where maybe it's a year out after school, or maybe it's right when they finish school and they realize that, hey, maybe school didn't do everything it possibly could to completely prepare people to be a physio, because how could you ever be 100% prepared? And I think a lot of people suddenly realize that they just don't know as much as they thought, or maybe they feel like they have a ton of imposter syndrome. So a common question that I was getting was just, how do you be confident starting off as a physical therapist when you're so aware of how little we, or as an individual, a person knows?
Great question. Go ahead, Zach.
Did you guys have any? Did you guys? I guess, were you at one point just not very confident and you just sort of got by, or did you try and fake it till you make it? What were your experiences?
I think that we all of us are uncertain every time. Like uncertainty is something that is always there, and you may be practicing for 1 year or 5 years, 10 years, and you will always have that kind of uncertainty. I think that it's part of the profession, because healthcare professions at the end of the day need to deal a lot with that kind of stuff. We are not like mathematicians or physicists that are always having like a defined number. They don't treat with persons. Biology is really complicated. So I don't know. I've been practicing for 1 year, and maybe my answer will change in the next 5 years. But for now, I'm very uncertain about everything, most of the things that I do. Even when I have read kind of a lot of papers, and I have tried to reduce uncertainty as much as I could, I've always found that wall of uncertainty behind every one of my decisions or actions.
And this is coming from the person that's read 2,000 papers in the last couple of years.
Yeah.
So,
No,
guys.
but
Seriously.
it's definitely important though. Like Diego, so for you, like coming in with that lens of uncertainty though, like you're still, I imagine you're still conveying some level of confidence to
Right.
to the patients that you're working with. I
Yes.
imagine it's, yeah. So, I mean, speak to that. Cause I think in my mind, there's like two schools of people entering the profession. There's the people like me who thought they knew everything and were like super prepared through a very biomedical lens. And I'll talk about my own host of issues with that because I'm getting flashbacks. But then for the people that are entering in more of the nihilistic phase, where they're like exposed to everything and combating uncertainty, like how do you talk to patients in a way that balances that?
I think that you can both realities can coexist. So you can be really uncertain, and at the same time you can be really confident when it comes to patient communication. So, for example, I may have an ACL patient 2 weeks ago that was really worried about his knee because he was having some kind of issues that are related to what I call the grumpy knee. So I didn't know the cause behind that. I just tried to modify the volume and reassure and all that stuff. And I asked him, give me 1 week, and in 1 week we will talk again. And he was like, okay, I will do it. And he trusts me. And the next week he was really okay and all that stuff. So I think that you can reconcile both uncertainty and confidence.
That's a great point. I think everyone experiences that level of, oh my gosh, am I ready for this? That I'm now grad. I'm supposed to be a physical therapist. I have DPT by my name. I'm in clinic. And for the most part, hopefully people get better in the orthopedic setting, for example. And if they don't, and they start hitting that wall and they're plateauing, you start sometimes doubting yourself. And I think it's important to recognize that you know more than you think. I always reassure my students like, you've made it this far for a reason. You've covered the basics. When in doubt, just go back to the basics. We know strengthen what's weak, comforts what's painful, educate what we know, reassure the patient, cover your bases, and then you can zoom out and question your decisions and get more skeptical and particular about what you choose to do and why once you get that first pass done. I think when I like Zach, I feel like there's different stages of getting more experience in physical therapy. And I swear, it's just that 1 years 1 to 3 is one thing. Then after year 3 to year 5 is another. And then after 5, you feel a different way. I think it's find comfort in that it's okay if your opinions change, and it's okay if your uncertainty wavers in different ways. You become more certain in some things and some in others, but that confidence that you convey to the person in front of you remains important because that person is trusting you with their care, and that's a huge part of what the outcome will play out like.
Yeah, so just adding on to that, like all well said. And I think for me, like I graduated with a, you know, we're trained highly to be like diagnosticians, where it's like
Yeah.
we're finding the problem, we're identifying the problem, we're fixing the problem. So like I get flashbacks to like drip sweating when I had people coming in with complex pain issues, and I'm like, oh shit, like is it their L4 that's just not moving as well as it is on the right? Like, so I felt a lot of pressure. And I think for a lot of new clinicians who are still in that mindset, they can feel a lot of that pressure on themselves to feel like they need to find the problem. And
Yeah.
and ultimately what was one of the most liberating and like practice changing things for me was advice from a mentor of mine, Chris Johnson, who was like literally be genuinely curious about the person in front of you. Like it sounds so silly to say that out loud, but when we graduate, we're like, okay, we need to find the problem. A lot of our objective testing where just like learning how to ask better questions, learn more about the person, what's been leading up to the issue, identify some of the bigger patterns. A lot of times it helps you kind of get a better understanding of maybe what's going on, right? Like give the example of Bob who's coming in with shoulder pain, and I'm like freaking out because I'm like, oh well, your scapula's is 4 degrees, more abducted than the other, so maybe that's what it has to do with. When reality, like if you asked, he had just done a massive painting project over the last 2 weekends where his shoulder was really sore. But a lot of times we don't focus on that stuff. So I think again, it's obviously reconciling. We're not throwing away like some of the objective assessments that we're doing, but there's so much that can be gained just from asking better questions, being curious about the person in front of you, and it helps you build that rapport, build that trust. And I think Diego would probably agree from an uncertainty perspective, like you can acknowledge maybe that, you have confidence in the direction that you're going, but also if, being forthright and being transparent about maybe some of the evidence about something, and or saying that you're going to be looking something up or leaning on a coworker. Like I told patients when I worked with a great team, like, hey, like I'm really confident in my team's ability too. So if we're running into any walls, like it's a very collaborative environment. So don't feel like you need to have it all figured out. Also, I think we just have a lot of these implicit pressures that we feel as new clinicians. So it's a challenge.
Mm-hmm. One thing that I think I just was reminded of, Zach, when you said you had this like complex pain patient, you're trying to figure out what was going on with L4. I had a similar consult recently, and the guy's symptoms were really, really complex. And I easily could have got lost in the rabbit hole of trying to diagnose everything and figure all of that out. But I just kept on asking him a little bit more about himself before I, dove into the specifics of his symptoms. And he was telling me things about his health behaviors, how he sleeps 4 hours a night, how he drinks a lot, how he's very high stressed, and how in the past he's had those issues as well. And whenever he has those issues, he starts to be in a lot of pain. So, like we just sort of had this conversation. Like I could try and be very specific and try and address all these different concerns, or we can just, sort of take a global health approach here. And we opted for the latter. And so I think that just, again, comes back to sort of what you said as well, Leada, where you just go back to the main principles, like reassure the patient, but also like connect with them, right? And ask questions. I think one last thing I'll say on this is I took Greg Lehman's course pretty early on. And the way that he starts it is he asks, let's make a list of all the conditions where we need to be very, very specific for in order to help somebody. And when you do that little thought practice, oftentimes those conditions are pretty serious things like fractures, things where you really only have one option. So another reason I became so comfortable with uncertainty, like Diego was talking about, is that oftentimes in physiotherapy, we're allowed to be uncertain and still be able to help people. We don't have to have all the answers in order to help someone. Any final thoughts on that topic before we move on?
last thing I would just say, like cheat code for new grads is getting better with your prognosis. Like understanding prognosis with basic conditions you see gives you so much more realistic reassurance. So that when you are, because I was like when someone came in with low back pain, like acute radiating low back pain, I'm like, oh my God, like I'm so scared to do anything. When the reality is, the more you are comfortable with kind of the prognosis research, it really helps you feel like, okay, we don't need to dismiss the fear that they're having, but we can also realistically be optimistic about the outcomes that we're going to have. And I think that's something I didn't really emphasize early on, but thanks to people like Greg, Ben Cormack, like really instilled that. And I think that's a really big cheat code for setting expectations, which is critical from the initial encounter perspective.
Mm-hmm. Well said.
According to what Zach said, I think that it should be mandatory to know the natural history of most of the pathologies that we see, because sometimes it's like they don't pay or they don't give the attention that it deserves, and you may be going crazy about a fasciitis that is not changing at all after 1 month or so. And it's like, okay, these things take a lot of time, and if we check the research, maybe the evolution of the symptoms is going to be really, really, really slow.
I'm really glad you said that, actually, because there was somebody who asked me if we have a resource for the prognosis of conditions. Diego, do you have anything, or Zach, or anyone?
Yeah.
I have the papers, but nothing.
If you look up most, like, so for I think about, I have flashbacks to like tendinopathy. Someone coming in with like patellar tendon pain, and like 2015 Zach, I was crushing some transverse friction massage, and I was like, all right, how long do I need to be doing this for? And then they're coming back like a week later, and I'm like, oh my God, it's not better yet. So, but like knowing like chronic tendinopathy takes months, like 3 to 6 months at a minimum for most of it, that would have been helpful for me to know to better set my own expectations and patient expectations. But basically, if you go, so like if you're curious about tendon pathology, if you look up kind of like the most recent consensus or like guidelines around it, it'll usually most research will kick off with kind of a prognostic review for whatever condition you're looking at. So if you're looking at basic systematic reviews, they'll have that, or you can kind of dig into the references and peruse some of those resources, and
And the
prognosis is listed in
JOSPT
there.
clinical guidelines also tend to include that.
Yep, exactly.
Awesome. There's a new physio at our clinic, and he came to me because he was struggling treating someone's tennis elbow, and it's 3 weeks and he's only gotten a little bit better. I'm like, you're killing it. That's great. It takes time.
Nice.
Yeah.
Yeah, setting those expectations early for stuff like tendinopathy or like,
Huge.
God, radiculopathy, any kind of nerve stuff, or like something that is just so related to people's lifestyle choices, like sleep and alcohol, and like just like the excessive, like, what are you doing? I sleep 4 hours a week, and or 4 hours a night, and it's scattered. Like sometimes it's at 11, sometimes it's 2, and I'm like, okay, let's talk about this. Being okay with communicating. This is gonna take it could take a while, but that's normal that it can take this long. So just be
And
patient.
about that, we're talking about natural histories, but I believe that it's also important to know like uh, the treatment lasts like 1 hour at most, but
Yeah,
the patient has another 23 hours going on. Many things
correct.
are going on that we don't have any control about, and the outcomes may be much more, or well, they are much more influenced by those remaining 23 hours than by the hour they spend with
Correct.
us 2 or 3
Hmm.
times per week.
Yeah. An hour if you're lucky, right?
An hour if we
Yeah.
So, Zach, you've talked about your evolution from a practitioner that was a little bit more biomedical to who you are now. And another common theme of some questions that we got, and we sort of touched on this a little bit already, but people are concerned about not really knowing how to practice. Maybe they get out of school and in school they learned maybe some more biomedical content, and then online, they're coming across things that are a little bit more biopsychosocial or pain science based. So it's a really general question in one way, because I'm sort of asking, like, how do you be a physiotherapist? What should practice look like? Maybe it would help ground us if we could think of like some core values that we should have as physios, and then maybe, what a typical session will look like with you.
Oof. Okay. Well, I think for just like to start, I think Leada knocked it out of the park, because if like I'm picturing the new grad that's like coming in with very biomedical schooling, but they're seeing everyone on the internet yelling at everyone for being wrong, and they're like, oh my God, I don't want to do anything wrong. What do I do? And I think what Leada said was like, strengthen what's weak, calm what's painful. But it's I think like the narratives that we use around it, right? Because I think if we're coming into it with like, well, you have pain because you're weak, that's different than, hey, we have an opportunity to improve this area that we found not to be as strong as the other side. So this is probably a good thing for us to be working on. So I think just to like start from the basics of like, how can someone move forward? I think that's a pretty good starting point. It's just kind of reconciling some of the narratives that you're using around it.
Mm-hmm.
Yeah,
I think there's often a lot of confusion. Sorry, go ahead.
No, just going off of that, and being okay with, well, honestly, I think as you're a new grad and you take a job somewhere, it's easy to be molded into the PT that works at that clinic. So whatever that clinic style is something that you naturally adopt. It's just the way they do stuff, unless it's a type of clinic that's like, no, like do whatever you want. But generally, it's sometimes like I worked at somewhere where it was almost their branding to treat a certain type of way, and it was exercise based. It was a little bit a sprinkle of manual therapy, but the exercises were very similar across the board. I think everyone sort of had that experience. Um, I think being okay with knowing that your style might change as you go through your career as a physical therapist, and that might involve more exercise or more manual therapy, but it comes down to being able to tailor what the person in front of you ultimately needs. Um, you might like I didn't feel like I had my own PT identity until maybe 5 years in, 4 years in. And I'm still evolving. Like, who am I? How do I treat? What's my style? But I recognize that I have a bias towards exercise because I'm in sports, and for all the other reasons that exercise is so cool, and how the million and one reasons why we all need to do it more. But I can recognize that, and I can say that, and I can tone it down if needed, if the person in front of me needs something else. So knowing that your style might evolve as you learn more and as you put yourself in different environments, mostly being okay with that. It's not a bad thing if you decide to use one treatment mode over another, as long as the narrative you're using is still the best possible at that point in time in history.
Hey physios, I know that we all know how expensive continuing education courses can be. What if you had the chance to learn from some of the brightest minds in the industry from the comfort of your own home, all at the fraction of the cost of those weekend courses? This is where Masterclass by Physio Network comes in. Imagine having front row access to the world's leading experts breaking down complex topics into digestible module-based video courses. It's basically like Netflix for physios, and it gives you the option to learn about a ton of different topics. If you're interested in a particular area, the chances are that Physio Network already has a masterclass on it, or they're working on one right now. Masterclass is your ticket to staying relevant, informed, and delivering the best care possible to your patients. Click the link in the show notes and use the discount code NOAH10 at checkout to get an exclusive 10% off on Masterclass. Don't miss this opportunity to elevate your expertise. If you're still unsure, test it out with a 7-day free trial. You're going to love it.
Yeah, that's a really good point, because you're going to say things that you look back on and you're like, oof. Maybe
Yeah.
not the best thing, but I think ultimately the world will continue to turn. We're just trying to minimize some of those like nocivic effects as best as we can. But I know went through a phase where I was like walking on eggshells to make sure I like didn't talk about anatomy, or didn't talk about pathology, where again, it's the context that we provided in, right?
Yeah.
This is such an important thing. Core values, Noah, I think for me, and it's probably similar, but it's being grounded in like humility and critical thinking, so that we're open and we're curious to like being as least wrong as possible for the information that we're providing to our people. For me, my treatment style is very much grounded in kind of exercise and education. I've moved away from like hardo pain science, Zach, where like pain splaining, doing the flashcards, everything. Where for now it's really like exercise is my Trojan horse for pain education. There's obviously key messages that are delivered alongside that, but it's also embracing more of that minimum effective dose of communication and education, because we're passionate. We want to like tell our patients everything. Like, here's the history of all the things you need to know, where it's like read the room. But yeah, especially doing mostly remote, it's for me, I get to lean into my bias of like having a clear plan. So like, what are our entry points? What's our criteria for decision making? What's our goals for this phase? How are we moving into the next phase? And using physical stressors to, move the needle, not just physically, but also in all of the other domains as well. So yeah, that's current Zach style. Talk to me in 5 years. We'll see.
Yeah, I was going to say, it may change. Who knows? But I think
probably will.
Yeah, but it sounds like, I mean, I really, I agree with both of you. I think it's just a very healthy place to be, like embracing uncertainty, emphasizing, like communication, exercises as a key tenet of what we do, and just, being mindful of the narratives that we use and try not to be necessarily like, I guess, just trying to be a little bit less wrong when we speak to patients.
Exactly.
So I want to switch gears slightly here. How important is life outside of the clinic for you guys? And how does your life outside of the clinic help you to be a better clinician? Leada, you sort of have your hands tied in a bunch of different things. I don't really see you as just a physical therapist, because you're an educator, you're a business owner, an entrepreneur, and you also have this huge emphasis on mental health. So do you have anything to say about that?
Yeah, I'm definitely an extrovert. I just full through and through. And through PT school, I'm someone who's like, if you invite me to something and I care about you, I will do everything in my power to be there, to show up and be present or whatever. So when PT school came around and all my other friends were in their early 20s, mid 20s, living their life, and I was getting like FOMO because I couldn't go to just everything because I had to study and give up a weekend. It it took a toll on me. So I was like, you know what? I'm not energized and I'm not passionate about being here right now because I'm so like I'm just not in a good headspace where my life feels balanced. I'm not getting everything that fulfills me. So I was started saying yes to things. I did have to manage my time better, but I think that I take that through being a PT. It's easy to claim a physical therapist as your identity when we're so focused on delivering the best care, constantly having to improve what we know and how we know it, and just reflecting on what you did that day. It just kind of becomes like, and everyone comes up to you at your friend's house and what can I do for this? It's just that's who you are, but it's important to recognize that you are more than just your title too. Like you are also a human being. So we are always telling our patients to, put things in different baskets. You get your exercise in if that's what makes you happy, but know that exercises shouldn't be your only form of coping for stress management if it comes down to it, because you're here for an injury right now. What else are you doing? Tell me about what you like to do to spend your days. And I think we have to take that too, because it can get, you can walk into the streets of burnout sometimes and you lose passion for what you're doing and how you even got here to begin with. And I think so just focusing on filling your own cup is a huge, huge asset to continuing to do what you love. So sometimes weekends come around, I completely disconnect. I take Sundays, don't post anything. And there was a point in the whole social media growth thing where I was like, I have to post every day. But ultimately, I'm like, I don't want to do this every day. It had taken off. It was fine. But I was like, this is not fun for me. I want it to stay fun for me so I can keep helping people. And by having to dedicate hours and hours to crafting a post and getting obsessed with the insights and blah, 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 that's not it. That shouldn't be why you're doing it. And just because you're chasing a paycheck shouldn't be why you're a physical therapist either. Or just because you want something next to your name, a title, or you want to work with a pro sports team or whatever, don't get me wrong, you have to stay passionate about what you do and keep hauling ass, but you cannot throw away all the other things that fill your cup too in the process.
Well said.
Yeah, I would add on to that. I mean, that's all spot on. I think for anyone out there listening, like one of the people I would highly recommend learning from, her book is a doozy, but one of the most impactful for me, Nicole Piemonte is her name. She's a medical humanities PhD out of Creighton,
Oh,
and her
cool.
book is called Afflicted, and it's definitely was my crash course and smack in the face with like philosophical jargon, but it's an incredible book. And a big thesis of it is just the it's corny, we say it all the time, but like the human piece of healthcare. Like if we want to better connect with our clients and our patients, like you can't be this sterile robot. Like you have to let your personality out. You have to let yourself out. Obviously, professionalism, when we think of it traditionally, is this like white coats. We're like, prim and proper physical therapists, which
Yeah.
again, nothing wrong with having that vibe per se, but not at the sake of letting your dwindling down your personality or like not letting yourself out in that. So that's even just within physical therapy practice. And like as someone like
Yeah.
I was really burnt out. I was working in a setting where, it was like as good as it gets from like a traditional
Yeah.
insurance based setting. But one of the biggest things that I learned and that I advocate to newer clinicians is like boundaries are so important. As someone like Leada, like I'm constantly giving and doing. Like I'm going to go above and beyond
Mhm.
for everything that I do because that's my personality. That's a part of who I am. But if that's like you need to have expectation setting with your boss and with your employer because like they're like cool,
Mhm.
keep being a rock star and doing all these
Yeah.
things, but like your year comes up and it's like sick, here's a 2% raise that you get every year, and it's like again, you're not doing it just for the money, but there's certain things, right, where you just need to make sure you're respecting the energy and time you're putting forth. You need to make sure that you feel supported and appreciated. You need to make sure that there's clarity and expectation. So I think just advocating for yourself, having boundaries is key. That way you can live your best life outside of the clinic. And now it's like, now we're over here having all the boundaries. Go play tennis once a week. During the week, I go lift with my wife every 3 mornings a week. And it's like, I'm living my
Yeah.
best life right now. And there's a time to kind of grind. I think when you're earlier on, it's easier to kind of just like put your head down and just
Yeah.
work. But for the longevity sake of your career, like you really need to have boundaries so that it's sustainable and make sure you're in a place where you feel appreciated and respected. And you know it's not going to be perfect, but if you have boundaries in place, it sets you up well, I think.
Yeah, and I believe that it's the same for me in the sense that you're a person before you're a physical therapist, and that's kind of something that will define all of our choices. So I remember that Aristotle said that what defines you is what you do during your free time, and in that sense you're a physical therapist for I don't know 8 hours a day, which makes like 40 hours a week. But it's the same like with patients, like you have a lot of time beyond the clinic to do a lot of things that escape what you usually would do at the clinic. So in that sense, uh, I would say that I don't feel guilty at all to spend a lot of my free time doing things that don't have anything to do necessarily with physical therapy. So now I'm doing jiu-jitsu and MMA and going to the gym and reading books and all this
Nice.
stuff. And it's true that because we care a lot about our patients, we spend a lot of time beyond the clinic too, trying to, for example, every day and kind of writing something for some of my patients so they I can print it and give them like a leaflet, like something that they can read again and again and again if they have any kind of doubt. Or for example, all my patients, the day they live with a gym routine, so they have kind of an idea of what they could do if they were open to spend time at the gym. So yeah, that's true. That's time that it's not being paid, but at the same time, I feel better by doing that. Because I feel better, I kind of reduce the burnout. Even it's like kind of paradoxical because I'm spending more time, but at the same time,
Yeah.
I'm reducing the burnout because I'm trying to practice in the way that I believe that is fair for both not for both, but at least for the patient, at least for now. I think that
Yeah.
Zach has a really similar story in that sense, that he was spending a lot of time beyond, and Steph too.
Yeah, I mean, Lita, I'd be curious your experience as a Noah too. Like that's, I
Yeah.
think, one of the difficult constraints of a traditional insurance model is you want to go above and beyond. You want to, like, my wife Steph had a full
Yeah.
caseload of ACL clients where it's like
Oh,
they're getting in, it's like you have a patient that has 12 visits to use for the whole year. Come
yeah.
on. It's like, what are we like? Either they're going to get the care, like they're not going to get the care they
Hmm.
deserve and it's going to be incredibly mediocre, or Steph's going to go above and beyond to
Right.
provide them with what they need, or it's going to be in a middle land where it's like an a
Yeah.
rushed version of a basic program they can do that's not sensitive to feedback and there's not really that guidance. So
Yeah.
it is a really big challenge, I think. But I think if you feel supported by your boss and they're supporting you doing that, that's obviously super important. Um, and then hopefully, um, if there's a way that you can get compensated or build it in, it's helpful because like I did it for 5 years and Diego super fulfilling, like because I knew that that's what I believed was the right thing to do, but eventually it kind of caught up with me where I started to become resentful because I'm like I know
Right.
this is the right thing to do, but I'm also need to be respectful of my boundaries. Um, so
Yeah.
it's tough to say because you're doing the right thing. So yeah, I don't know.
Yeah, I mean it's not sustainable in the long term because it's time of your life that you could be using for very different things, but at the same time you feel that it's the proper thing to do. So
Hmm.
it's a dilemma, and the solution at the end. I think that if we could provide the care that we want, while at the same time charging relatively similar to what they could get from at least I'm not going to compete with insurance because I know that insurance is quite triggered, but at least with the average cash clinic, so we can at least compete to some extent. And one of the things that I've seen you talking about it, it's that telehealth make it easier to kind of expand the treatment time, so you don't need to have 1 hour sessions. You can have
Yeah.
15 minutes per week because this is going in the long run. So that's a really good point, and that's something that I'm interested in, but I don't believe that it's at least my moment for now.
You're getting the reps in now.
Yes,
Yeah.
that's the thing. Yes.
Yeah. That's that can
The
be tricky. Go ahead. Go ahead, Noah.
No, go ahead, Lita. It's okay.
I was just gonna say the boundaries can be a learned experience for sure, and I think we'll always have to learn how to set new boundaries as we all go through life and things change for us and our circumstances. But so, like for in the sports setting, if you're getting an athlete from another sports medicine clinic or their team PT or whatever, and they're an elite athlete, you sometimes have that athlete on text message. Like they can contact you 24/7. And if you're treating them while they're away from their team or their hub, you have to sort of be on call like that. But recognizing when that can be not sustainable for you or sustainable is a skill. And it doesn't, I mean, you have the power to educate your patient on how often and when to text you or email you or check in with you. Like if this is what I want you to watch for over the weekend. If this, and this happens, no need to let me know. We'll check in on Monday. If something like this happens, I want you to email me right away or text me right away. And then there's the whole side of things where when you're dealing with someone just general orthopedic and you want to give them more throughout the week so that they are doing something every day, and then I know that you feel that that's what is fulfilling. Sometimes it's good to step back and recognize like what is necessary for this person in the next 2 weeks, in the next week. What are the most important pieces? Maybe you write something up for them that's like, hey, week one, maybe add one or two exercises like this in the gym. Week two, you see them in 3 weeks. So covering some general things over specifics and giving them too much detail can be sometimes a trap, because I know you want to not you specifically, but in general, when you're a student, you want to teach them all the things and give them all the information and give them the best care. But sometimes people don't need as much as we make them out to need either. Just simplifying your care and simplifying the goals and empowering them to take that into their own hands a little bit can be a nice game changer for making sure that it's just not you delivering their care, but they're participating in that as well. And that's fulfilling for them too, because they feel like they're involved for the most part, just the right person.
Cool. It's a long career. And the reason I asked about your lives sort of outside of the clinic is because people were asking about how to prevent burnout. And Zach, you said like when you're young, you could keep your head down and you could just work a lot. And in my first year of practice, at one point, I was doing that, and I probably could have kept going for a little bit longer, but I could already sense that it was just negatively going to affect my mental health. So,
Yeah.
I think focusing on your life, just your life, is also a really, really important thing to do. I guess one last question before we all head out, especially for Leada and Zach, and actually Diego as well, who's built a very successful Instagram account. I'm curious as to if you have any general advice for people to create other sort of career pathways. You know, we just discussed telehealth as well. But we also have, people who run successful social media pages here, people who are adjunct professors or mentors. So any advice along those lines?
Go ahead, Zach. This is, I think you take the
Um,
lead on this.
I think it starts with kind of like defining what your own kind of North Stars are and what you're passionate about. Like for me, I literally applied to college as a history major because I thought I wanted to be a history teacher. So like education was always the common thread of something I was really passionate about. So even through PT school, getting to TA, like I knew that teaching and education was a really important piece for me. So I was immediately finding opportunities and ways that I could do that as a new grad, whether that was reaching out to my alma mater and doing a guest lecture or starting to do stuff on social media in the 2015 come up of the IG physios. But I think like know what you're passionate about because there's so many different opportunities. Like we have an amazing like you know writer that's a part of our team who helps us with all of our emails and social media, and like he's super passionate about that, and so he was able to, through authentic relationship building, like land this opportunity with us where he can do that. So whether it's doing research, like if you're passionate about research dissemination like Diego's doing, it's like I think the key is just being true to you and like understanding what's authentic, because that's what's going to come across. I think that's like a major key for being successful in that, and know there's a variety of different ways, whether that's clinical, non-clinical, adjacent, anywhere in between. Like there's really endless opportunities for flexing our skills.
Yes, and I believe that the issues that the college prepare us to be clinicians, and we are all kind of
Right.
shaped into the form of a rectangle. Like every one of us has different aspirations, and we need to try to find our way to be fair with ourselves, but also fair with what we envision our life to be. And for example, I think that the route is everyone starts as a clinician, some becomes educators, some become researchers, but there are far more opportunities out there, and you could become, for example, a politician if you want to, because we are now seeing a lot of issues with the APTA. Like you need people
Yeah.
in politics to change the stuff,
Right.
and nobody is thinking about becoming a politician when they start physical therapy. So that's one way. Or I mean, as a writer, for example, there's a follower that told me the other day that if I was making a living by writing my content, and if I wasn't, that I could try to make a living writing content. And I thought, okay, that's not what I envision my account to be, because I want to be a clinician, but it's a valid choice too, because for example, pain science, Pauline Graham, he's doing that.
Mhm.
He's not a
Yeah.
clinician. He's just writing about the stuff, and he's making a living out of that. So why a physical therapist shouldn't expect to make a living with that? So there are many choices. There are many choices.
Yeah. I think on the clinical, non-scientific side of things, I I think we could all, everyone's got an interest growing up. This is so interesting because I actually just talked to another woman about this on her podcast. She's like, "Did you ever think that you'd be doing this?" I was like, "No, I did not." I specifically said I was not going to be on Instagram and I would never teach and I would never own my own business. I said the word never, and I swear the only thing I do now is just don't say the word never when talking about something you think you won't do, because then it's going to happen. But I think we all go into PT school through high school. Like we all have these interests. I, for example, was really interested in design and photography and journalism, and I loved writing for the sake of educating the public about something interesting and in a fun and simple way. Who would have thought, fast forward, whatever, 15 years later, I'd do this on my Instagram, creating little Canva designs. I would do this. I'd end up writing a freaking book. Like I never would have put this together, but somehow those core skills seem to pop up in life when you least expect it. And so that brings me back to making sure that you're catering to yourself as a human being and staying true to what makes you excited about life, how you like to spend your time. You never know when you're going to need those skills and how it might show up as a physical therapist. Because I definitely did not think that this would ever be a thing.
That's
And I think it's
totally
just,
right.
it's humbling. Like, what?
Literally had zero interest in any entrepreneurial types of
Nothing.
aspirations when I was in PT school. Like none, nada.
Yeah.
Like, and like you said, Lita, like through some of these different experiences, I ended up realizing
Yeah.
that like I love like solving problems. Like I love the creative
Right.
outlet of being able to solve problems in creative ways. And I've
Yeah.
learned that like, holy shit, like that is I love that. It's so fun.
Yeah.
And I would have never known that if I didn't kind of pursue some of those different things that light me up.
Yeah,
And
and
I want
it's
to go
exactly
opposite.
that.
Go ahead, Bella. Mm-hmm.
I'm just gonna say you have to
No,
pursue things that
yeah.
light you up, but you go.
Somebody was telling me that he was looking for a job. This is a friend of mine. He was like, I have all this mishmash of experience. He's had taken on different roles, and he's not in physical. He's in tech, so this is like very different. But he's like, I have just a mishmash of experience. I don't know where I'm headed. I'm like, hold on, zoom out your resume, take away all of the titles that you've held, and just look at what you've done. And which one of those things have you actually enjoyed? Was it communicating with a team? Was it managing people? Was it coming up with problem solving skills for a major issue that's company wide? Little things like that, I think we forget make us such great clinicians. And you need all these random skills as you're going through college and PT school, and sometimes it's the life path and experience that just pops up into your, or the opportunity I should say, that pops in your lap and you're like, oh, I guess I could use that random thing I'm good at this, and then you end up enjoying it. So you can go on. I know you were saying something.
Yeah, I mean, in 2018, if you told me that I would be like creating content on social media and I would have a podcast, I would have laughed at you. Like I could have never have
Yeah.
seen this coming, but I decided to pursue education, which is one thing that I'm passionate about. And it's just exactly
Yeah.
what Zach was saying. Like just continuously pursue the things that light you up, and it's okay if those change over time. And I think you never know where life will take you. But I think the first step is just being passionate and pursuing those passions. And then the other thing to go along with that is just don't put yourself in a box. You know, we're more than
Yeah.
just physical therapists.
Yeah, and try things. Try things. Don't be
Mhm.
afraid, because I talk with many followers that tell me, I would like to make a social media account, but I'm afraid because I don't want to be heavily criticized by one people, or it's like, just
Yeah.
try, just try, because what's the worst thing that is going to happen? That someone in the internet is going to tell you that you are dumb? Turn off your phone. I don't know.
The world will keep turning, right? That's one of the
Yeah.
most powerful things.
Yeah,
No one is
Yeah.
remembered by the
It's
things that the rest of the people never heard. Like, you need to say the things
yeah.
if you want to be remembered for those things.
Yeah.
totally.
You have to suck at something once to get good at it too. It's fine.
Absolutely.
Yeah, and
I think
it's
that
okay.
nowadays there's an issue with that culture, like the culture of don't try it because if you do it wrong, people is going to make fun of you. And
Yeah.
at the end, if you want to grow as a person, you need to commit mistakes. That's part of life.
100%. Even if it's as a clinician, again, it's part of life,
Yeah.
and the world will keep on turning. Guys, thank you so much. I hope that everyone listening to this got a lot of value out of it. I know there was a lot of really good gems in here. So thank you for coming on and sharing your knowledge and your experiences and your wisdom. It means a lot to me for you guys coming to do this, but I hope it means even more to everybody listening. So much appreciated. Just to wrap up, let's promote ourselves. So where can the people find you? Zach, do you want to begin?
Yeah, I was looking up my Instagram handle. Zak Gabor. I spell my name Z-A-K. So ZAKGABOR. So zakgabor.dpt is my IG, and that's where I'm most active. And yeah, I will just say thank you, Noah, for getting this together, and Leada and Diego. Like, I was pumped to get to meet you guys because I do appreciate all the work that you're all doing to, like, it's really, there's something fun about individually taking on a challenge, big or small, that's making the profession better. So definitely appreciate all the work you all are doing.
Thank you.
You can find me on Instagram, mostly Instagram, a little bit of Pinterest, a little bit of TikTok, but mostly IG at DRMALEKPT, Dr. Malek PT. Emails on there too if you have questions or if you want to chat. Social media is probably the easiest way to connect with me, considering I'm on it a lot. But yeah, I'm thank you for having us. No, this was cool.
My pleasure.
And in my case, you can find me mostly on Instagram. I have a Twitter account that is physio skeptical, like the reverse. But most of my activity is on skeptical physio because honestly, I can't maintain any other social media account. I'm crazy when people is so able to manage a TikTok account, an Instagram account, a Twitter account. It's impossible for me. And I'm on Twitter mostly because I follow researchers. And I'm like, okay, I'm going to look a bit what's happening there. And on Instagram, I'm skeptical physio. So SKEPTACALPHYSIO. um, and thank you now, because in my case I think that things are changing, and when I say that things are changing is that um of course, being from Spain, I don't have that kind of physical contact that you all have. Some of you were together at CSM, maybe like the last week, maybe with Jason and all that stuff. And now I'm feeling that things are shaping. So I'm meeting many of you, at least virtually, but hey,
Yeah,
it's a beginning. And
yeah.
I hope that in the future we could meet physically.
Well, when I'm in
Amen.
Spain, I'll let you know.
Same.
For sure.
All right, guys. Thank you once again for listening to the podcast. If you enjoyed it, please consider leaving a review. If you would like to follow me on social media, you can follow me at noahmandel.physio on Instagram and TikTok. Have a wonderful day, and remember to keep moving forward.